Hanji, my name is Dr. Umesh Wadhwani and you are about to watch my workshop on periods. I conducted this workshop with amazing Dr. Apurva Palam Reddy. She's a gynecologist and a fertility specialist. बहुत ज़्यादा काम किया है उन्होंने ये फील्ड में and she is an amazing speaker. पीरियड से जुड़े हुए सारे सवालों के जवाब उन्होंने इतनी अच्छी तरीके से दिए हैं and you would know what I mean when you watch this workshop. I conduct these workshops every week. अगर आपको मेरे लाइव वर्कशॉप्स का पार्ट बनना है तो मुझे व्हाट्सएप कीजिए. I have a group there and मैं आपको वो ग्रुप में ऐड कर दूंगा and you will get the updates about my workshops, है ना. बाकी तो क्या, एंजॉय करो वर्कशॉप अच्छा लगे तो लाइक, कमेंट, शेयर इट विथ योर फ्रेंड्स एंड फैमिली एंड अगर मेरा चैनल सब्सक्राइब ना किया हो तो डू दैट और अपनी हेल्थ का ध्यान रखो. मिलते हैं.
The center of everything. It's always, when we say what is normal, it's always a range. So anything varying between 25 days to 35 days, if your cycle is varying during this time, then it's absolutely normal. So
Okay.
if you get your periods probably in 26 days, or if it gets extended by a couple of days more, there is no need to panic about it, or there is no need to get worried about it and start Googling and thinking that all the possible medical conditions that are there, all of them are there for you karke. So this range is all right, and once in a year if you do miss your periods more than this range, again it is still okay. If it kind of becomes as a repetitive pattern, and despite you having a healthy lifestyle and maintaining regular activities, despite that, if your cycle is not fitting into this, that is when we say that there is some sort of irregularity.
Okay. Interesting. So, how does it work with the days? Like, how many days should one bleed?
Right.
Like,
So that's what we're talking about now. Regarding the duration aspect of it, again, most people feel that 4 days is the right duration, or 5 days is the right duration. Anything again ranging between 2 days to 7 days is all right. If you bleed only for one day, and even during that one day, the amount of flow, in case it is just about one pad, then we say that, okay, the flow is very less. Or if you continue to bleed, mind you, not just spotting, but in case if you continue to bleed for more than 7 days, that's when we call, okay, you have heavier flow. But anything between 2 to 7 days is all right. And some amount of premenstrual spotting, some amount of post-menstrual spotting. That is, if you don't have to actually change a menstrual pad, or if you just use a panty liner and if you're comfortable with it, that's we don't consider those days also as your period days. They are just pre and post menstrual spotting. So anything that's ranging between 2 to 7 days of flow is fine.
interesting. Guys, we are still waiting for questions. I mean, I should be the last person asking the questions. I should just leave the meeting and you should carry it further, and I'll come back at 4. But it's fine. Like I have a list. Okay, my next question is like, this is what I get asked a lot on the fitness side of it. Is it okay to work out during periods?
So there is no one right answer for this. It's definitely based on your comfort level that way. Some women do feel they are weak during that time, and if they are having heavy flow, or they're just not comfortable doing those kind of exercises which involves too much of stretching, or too much of athletic movement. So they're just not comfortable doing exercises during that time. Some women have severe pain during their periods. Again, that will kind of prevent them from, getting involved with respect to physical activity. On the contrary, some women feel that during their periods, if they do some mild amount of activity or exercise, in fact, it kind of helps them reduce their discomfort and helps them to cope up with it. So some do regular exercise and activity during their periods as well. There is no one right answer for it.
Okay.
If you are comfortable doing it, then you can go ahead and do it. In case if you're not doing it, there is no pressure that you have to do it during your periods, and only then you're considered fit.
Okay. And there's along with the nutrition side only, there's another very common question, which is about cravings.
Sorry?
Crave,
Cravings.
cravings, yes.
Cravings, yes.
What's the deal with that?
There is honestly no medical explanation for it that way. The only thing that we can come up with is obviously there is some amount of blood loss. So there is
Sorry.
and yeah, because of that, you generally do tend to have a feel good factor in case if you have more sugar content. So that's the reason why some of them have a tendency towards eating slightly more sugar during the menstrual cycle that way.
Hmm.
So in case if you call that as a craving, so yes.
Okay. But like as a nutritionist, I feel there is an internal reason why someone is craving
Sure.
sugar. Or I used to have this, a silly argument with my ex-girlfriend about. I was like, तुझे है ना सिर्फ खाने के बहाने चाहिए, so you just look out for your, like, you just wait for periods so that you can eat whatever you want to.
Sure.
So it's like there is no other. Of course, the hormonal imbalance would be playing a big role,
Sure.
right? Are there any ways to control it?
Honestly, getting it out of your mind, when you feel that this is not in your control, or when your body is wanting it, that is when probably you'll have higher chances of giving in. So as you rightly said, they might feel that, okay, this is my periods, and there is a hormonal imbalance, and that's the reason why I'm wanting to have it. You have a higher chances of giving into it as compared to preparing your mind and saying that, okay, it doesn't matter if it's my cycle or not.
Yeah.
Yes, if I don't want to have this amount of sugar, carbs, or calories, then I'm not going to have it. So you definitely have higher chances of overcoming these sort of cravings.
Okay, interesting. मेरा questions का पिटारा खत्म हो गया. I'm joking.
You mentioned pads or panty liners. What's the difference between them?
So panty liner is similar to a pad, but you have it soaks only some amount of blood. So it's just for some amount of vaginal discharge, or as I mentioned before, some amount of premenstrual or postmenstrual spotting that you have. If you use an entire pad and if it doesn't get soaked completely, you still have to keep changing your pads about 3 or 4 times in a day for hygienic purposes. So you are technically, wasting the entire pad. So instead of that, you use a panty liner in the very beginning of your cycle or towards the end of your cycle. You are being a little environmental friendly as well, and it's a little pocket friendly as well. Beyond that, nothing much.
Interesting.
But I think you guys should be asking more questions about menstrual cups, because I really feel bad whenever I see online anyone going ahead and distributing sanitary napkins for the underprivileged, or even during COVID, I think a couple of people had centers wherein they were giving menstrual pads. See, it is great that we are talking about menstrual hygiene that way, but no matter what, sanitary napkins are disposable, and they are not the solution for a long-term problem. And if someone has actually not used any sort of menstrual hygiene products, it's much better that you start them with menstrual cups, which are more of a consistent and long-term benefit, as compared to just giving them one packet of sanitary napkins and saying that, okay, you know what, this is how it should be, but probably from the next month you're not able to afford it, but still you just should know that this is something that happens.
I would like to know more about it, actually, Apurva.
Sure.
Like, because they have become popular very recently.
Right.
I've started hearing about them, like, I would say since a year.
Sure. I think the awareness about it has started only about a year. And that's because, Umesh, menstrual cups have been there for over 10 years now.
Okay.
The problem is you don't have big brands like either a Whisper or a Stacey, or who are putting in a lot of money into it and promoting it big time over the television market, or over big hoardings, because obviously they are sustainable, and you kind of buy one menstrual cup and that's going to last you 5 years. It's not like, you have to keep purchasing or keep using it. So that's the reason why awareness is less, because there is not sufficient marketing, or there's not been so much money that's being putting into it for the marketing aspect of it. So the most common questions that I kind of encounter are, one is, in case if you are not sexually active, or in case if you're not married, or if you've not had intercourse for the first time, can we still go ahead and use a menstrual cup? And the answer is yes. So you do have different sizes of menstrual cup. And I'm not going to lie, the first couple of times it is going to be uncomfortable. But once you kind of get used to it, it's really going to save everyone a lot of hassle from, be it vaginal infections or itching, or, the dryness that a lot of women experience. And especially for someone who's having heavier bleeding, this definitely works much better as compared to any other form of, menstrual hygiene products.
Interesting. And how, like, are they expensive? Like, how much do they cost?
So each menstrual cup would probably cost you about 1,500 to 2,500.
Okay.
And as I said, that is going to last you for 5 years. So even if you kind of consider that, you're spending about $250 every month for about, your sanitary napkins, in about a year you should, or, probably less than a year, you should be able to recover the entire amount. And think about how much environmental friendly it's going to be. If we talk about the environmental aspect, I think the tampons are much better as compared to sanitary napkins, and cause menstrual cups beat everything hands down.
But then in country like India, with tampons and menstrual cups, there is this notion around virginity as well, right?
Oh, sure, absolutely. But in a welcoming way, I think it is changing. I'm really happy to see a lot of young girls who are coming up front and, asking us about, a menstrual cup and how to use it and so on and so forth. As I said, if you can train, a 12-year-old or a 13-year-old to use a sanitary napkin and, to kind of dispose it well, I'm sure we should find ways to kind of train them as to how to use a menstrual cup. And if you are able to, teach 8-year-olds and 9-year-olds about a good touch and bad touch, I don't see any reason why we can't, encourage them to actually start using these at a much younger age.
Interesting. There are a couple of questions around. I think we already spoke about tampons and cups. There's a question about, what about intercourse just after periods? I've heard that vaginal opening is not normal after periods, so it might be painful.
So the vaginal lubrication is what is important for you to make sure that intercourse is pain-free and, it's comfortable that way. Immediately after you have your periods, yes, the amount of secretions that you have or discharge that you have is going to be less, because the vaginal space is altered because of the blood that has changed the pH value per se. So there might be some amount of dryness, but this is not universal for everyone. It varies from person to person. And in case if you're using a good lubricant, it shouldn't be uncomfortable for you. In fact, a lot of people prefer this time also because it is considered to be most safe period, what we call, even from a pregnancy perspective, that way immediately after you have your periods.
I think we can, I would like to extend that answer. Like, what is the safe period like for women?
So when we are talking about a pregnancy perspective or risk of pregnancy, we are trying to calculate the ovulation time. Now, if you're having a 28-day cycle, or if you're having a 30-day cycle, 14 days from when you're expecting your cycle is when your ovulation would happen. So it's a retrospective thing. Let us say you get your periods first of every month, and you have a 30-day cycle. So you anticipate that your ovulation is going to happen somewhere between 14th or 15th day. That's when the ovulation happens. Now, the egg is alive in the body only for 1 day.
Okay.
So we should make sure before the ovulation happens, at least 5 to 7 days before that, is when you need to make sure that you've not had unprotected intercourse, because the sperms can survive in the body of the female partner for up to 7 days, like maximum. Some range from 2 at up to 7 days also it can range. So if having a 30-day cycle, and if you get your periods on 1st, so you're anticipating the ovulation might happen on 16th, which means from 10th, to ensure that you're having safe sex. That is, you need to use some sort of contraception. So if you get your periods for 5 days, that 5 days, so from the 6th day to 10th day is what we call it as safe time. And of course, as I said, after the ovulation happens, it doesn't matter. Once the egg is released, it's released. So 10 days before you actually have the period also is considered as safe time.
Okay. So how about during period?
Yeah, absolutely. During period also, you don't have possibility of pregnancy. But again, for hygienic purposes, we always don't recommend intercourse during periods.
Okay.
Because sometimes there is a possibility of, in case if the woman is having heavy bleeding or heavy flow, sometimes there is a possibility of mild, what we call as a retrograde flow to happen. And, it can result in infections per se. We don't always recommend intercourse during periods. But yes, if you are having it during periods, it's definitely safe and you don't have risk of pregnancy during that time.
Okay. Fair. Wow.
Ma'am,
Yes.
Yes.
how do we know about what size to use of menstrual cup?
Okay, so there are 3 sizes that kind of come with it. You have, and each company has their own name for it. You have a small, medium, and large, or you have a petite and different sizes. Someone who's already had a vaginal delivery, we say that, okay, they might require a large cup. That is the maximum size of the cup. Someone who's been married and who's not had a delivery, for them, we kind of say delivery in the sense as a vaginal delivery, then they might require a medium. And someone who has not ever had intercourse, for them, you might need a small or a petite cup. Now, this is a very, very generic assessment as to what is the size of the cup that you might require. Because you should be able to actually take the cup and, once you insert it, that's when you will know exactly if this is suiting you or not. Because once the menstrual cup is inside your vaginal space, you technically will neither have any pain or discomfort, or you shouldn't actually be feeling it. Yeah.
Okay. I have a really silly question, and I may get laughed.
There's no question as a silly question.
But so I have a niece who is like she's 17, and we do have conversation around her menstruation and hygiene and stuff. So I was recommending her menstrual cup, and just after this answer only, I just thought of, like, what if we are ordering one and the size doesn't fit? Like, do they have replacement or something like that? Or how does it work?
No, again, as I said, with respect to, because of the hygiene issue,
Yeah.
I don't think they will really be able to kind of take it back. But most of the cups, as I said, they will kind of give you a specific measurement as to, how it looks and, what is the size of it, so on and so forth. And this is the basic thing that I have recommended. 90% of the women will fit into this category, 90%. If they've never had intercourse, the smallest size would be perfect for them. If they have had intercourse and they are sexually active, a medium size would be perfect. And in case if they've actually had a vaginal delivery and if they feel that the spacing is wide, they might require a bigger cup. So it's just a estimate that we can do it, because there is really no way that we can measure the girth or kind of really understand how it's going to fit for us.
Now makes sense. Okay. Thank you, Anjali. Thank you, Apurva. Okay, next we will go for sometimes without reason, I cry on my period time. No pain in my stomach that time. Any reason behind that?
So you do have a lot of hormonal variation that is kind of going on in your body. In fact, there is hormone withdrawal. That is, during your period time is when all the hormones in your body are at their absolute basal level. they're at their absolute basal level. And from that point, there is a build-up. And, that is the reason why sometimes we say that you have, when we say PMS, that's as a premenstrual syndrome, because, your hormones are really low. And that's the reason why emotionally and physically also sometimes you might feel low. I think it is more important that we are aware about it, and that you kind of don't take it too hard. Some might feel that they are low, and they might feel like crying, and some others might feel that they throw tantrums, and they get angry, and they fight with people, and say really mean stuff to people and things like that. Especially the husbands and boyfriends that way are sometimes at the receiving end of this scenario. So as long as you're aware about it, and as long as it passes away quickly, and as long as it's not intensifying with each month, these three, I think, are the important aspects of it. In case if it is under control, then I think it should be all right. If you feel that it is affecting you, and it is kind of really emotionally bringing you down, then you can take certain multivitamins during your periods time, what we call as evening primrose oil and vitamin E supplements and aloe-based supplements. These supplements can improve the symptoms that you kind of do experience during this time, be it physically or emotionally as well. So yeah.
I think so a couple of others had a similar question, but I'll just read out. Bhavna is saying, on my first day of period, I feel a lot of pain, which hampers my whole day. The pain is not continuous, but it's like थोड़ी देर में pain होता है, and the second day is just like a normal day. Is there anything to worry about?
So I have actually, in the past also answered this question a couple of times, and it kind of goes like this: that whenever you get period pain, we categorize it into two types. One is a primary pain, and another is a secondary pain. So primary pain is wherein your body just has a higher tendency to react towards pain, and you're just more prone to experiencing that pain or having that pain. When there is absolutely nothing wrong with you physically whatsoever. Whereas secondary pain is wherein you have pain because you have a pre-existing pathological condition, be it a cyst or some sort of lump or mass or some sort of infection, which is kind of triggering the pain during your periods. And the only way that you can really differentiate between the two is in case if you go to a doctor and get yourself checked. If you are having a primary pain, all you can do is, bedajak, you can go ahead and take painkillers during this time. It's not going to harm you. It's not going to give you any sort of long-term impact, or it's not going to hamper your fertility chances or even pregnancy chances that way. There is no need for you to really suffer through the pain. You can take maximum up to 3 painkillers in a day and up to 6 painkillers in a month safely. That is for your primary pain. But in case if you actually have some sort of medical condition which is triggering this pain for you, then definitely you need to get that resorted before you go ahead and this pain settles down.
Okay, interesting.
Ma'am,
Yes.
what about the material of menstrual cup? Is it suitable for everyone?
It's based on anti-allergic silicone cups is what we have. And yes, 99% I would say, because it is hypoallergic. For most of them, yes, it would suit. Again, we are not, there is no physical insertion. It's not entering your system. It's there in one of the spaces. So which is why the possibility of you having any sort of severe allergic reaction to it is almost unknown. It's almost unknown. In fact, more girls probably have allergy to latex as compared to anyone developing allergies to the silicone.
Okay. I think Jyoti is saying something along the previous questions. Like she almost feels like fainting and weak during the period.
Yeah. As I said, sometimes in case if you do have very heavy bleeding or very heavy flow, or if there is sudden flow of blood that you kind of suddenly lose, at that time you are bound to feel weak. which is why it is extremely important that during your periods, you don't fast. You make sure that you are having your regular meals. Make sure you're having at least 3 liters of fluid in a day, which will make sure you're hydrated. So these are certain things, with pain, most of them feel pukish and, they don't want to eat anything during that time. And they go into this really bad loop. So unless you kind of have your regular food and make sure you're hydrated well, then things can only keep getting from bad to worse during your cycle.
Is it okay to have a period in 15 days in 40s?
So as you are approaching your menopause, so menopause is when you actually stop having your periods altogether. And for most Indian women, 50 to 55 is the average age of menopause that way. And up to 3 to 4 years before you actually attain your menopause, your periods can go a little irregular. So we usually say that between 45 to 50, yes, in your late 40s, you do have a higher chances of having irregular periods just before your periods stop coming. But yes, in case if you're having periods consistently for 15 days, even if it is because of a perimenopausal transition, it is going to weaken you up a lot. A lot of your blood will be lost, your hemoglobin will come down, you will have excessive hair loss. And you might also, have reduced concentration because your hemoglobin levels are less. So no matter what reason you're having the heavier bleeding that way, and no matter at what age group you're having it, it's always better to kind of keep it under control. And like I said before, if it's happening only once in a year, then it's absolutely fine. But if it's happening more frequently and, you are experiencing 24 menstrual cycles instead of 12 menstrual cycles, then that's definitely something that you need to, focus your energy on.
Awesome. I hope, Chaitali, you got your answer. I think I'll take a pause before we go for the other questions. Like, Apurva, I want to know more about you. What's up? Like, where are you based? What do you like? What's your practice like? Do you have a hospital? Do you work for someone?
Sure. So I think so. I'm essentially based out of Bangalore.
Okay.
Jayanagar to be in particular. I'm married to a cardiologist. My husband is a heart doctor, Dilka doctor.
Oh.
And yeah, both my parents are doctors as well. My mom is gynae and dad is a neurosurgeon. So it's just a lot of crazy doctor stuff that kind of happens all through the house per se. And I have twin boys. Both of them are 8.
Nice.
Yeah, so that's my personal life. And with respect to professional this thing, as you know, I am a gynecologist, but I'm more passionate about IVF. So I actually get people pregnant, a lot of people pregnant that way. And we do a lot of laparoscopic stuff as well, wherein we specialize in, removing big tumors through small holes. So yeah, that's what my work front.
That's nice. Like, I'm just thinking about your 2
boys, yeah, absolutely naughty.
But I'm just thinking, no pressure at them at all. It's like my whole family is freaking doctors.
My mom has already figured out what specializations she wants them to get into.
Wow.
Like the 3 Idiots kind of picture.
Wow. So, do you have your own setup? Like,
Yes, we have our own daycare center. It's in Jaipur as well. But essentially, I think with the pandemic, we are doing a lot of online consults as well. Wherein people across the world call us for medical consults, and even for some a lot of our clients in the US and Canada, we actually ship drugs as well.
Nice.
Yeah, medications per se. Because it's difficult for them to really get specialization. They have more of a GP based of practice, wherein they have to cross a lot of hierarchy before they actually get to specialists for advice. So yeah, we do get all of that.
Okay. Are you enjoying this new online phase?
I have to confess, I wasn't on Insta till May 2020. in fact, myself, Dr. Yuvraj, and about 60 of others, we did a video called Happy Doctors.
Okay.
That kind of went a little viral during the pandemic time. And that's the first time I came on Insta. And
Nice.
I really fell in love with the platform because it's really such a great way of connecting with so many good people.
Yes.
So yeah, I think I am definitely enjoying the Instagram phase. I'm a little late to it, but definitely enjoying it.
Nice. And if anyone of these people wanted to see you online over a Zoom session or something, they
Sure.
can consult you, right? Like one-on-one.
Absolutely.
Awesome. All right. Great. So, guys, the doctor's detail is on my Instagram. Like you can see her page as well, and her Instagram ID is exactly the same, Dr. Apurva Palam Reddy. So, हम आगे नहीं बढ़ेंगे जब तक आप उनको follow नहीं करोगे अभी. So, no, I'm just joking. I'm joking. Let's go for the next one. कहाँ गए? Should we prefer medicine? I think we have answered that question. Devanshi, we have answered that. Can old blood, which is brownish dark discharge, come in form of discharge after end of 1 week of periods? Is it normal?
This is what I was calling about, as a post-menstrual spotting. If it is just spotting, in case if it is just affecting your panty liner, or in case if it's just staining the clothes, it should be fine. But in case if it actually comes out as proper blood or proper bleeding, then it's something that you need to look into or cross-check.
I think we did cover that briefly before as well. Anjali has another question. Is it okay to have cramps in between periods?
So as I said, ovulation usually happens on the 14th day. And whenever you have ovulation, it is normal for you to experience some amount of cramping. It's not mandatory that you should experience it. It's not that if you don't experience the cramping, you're not having ovulation. But some women do experience it, and it is all right. The intensity also can vary from person to person. If it is mild cramping, then there is really nothing that you need to do about it. But if you are looking for getting pregnant, time duration is important because this is your most fertile time. And because you're having cramping, in case if you're not together or if you're not sexually active during that time, then it will actually pull back your chances of pregnancy. So it's that aspect that you need to be aware of.
Okay.
Imagine there is so much science behind it, and we are already a 1.3 billion.
I know. Okay, Grish, actually, there's another question which is, I think we have covered it, but if you can just briefly touch upon it. Is it normal to bleed for 2-3 days? Would like to know what is considered the normal blood flow during menstrual cycles.
Sure. As I said, 2 to 7 days of duration is fine. 25 to 35 days of length of the cycle is fine. Changing up to 2 pads in a day is considered normal.
Okay. Now, next question is, I think it involves medicine. I'm not sure if you'll be if you want to. Hello, ma'am. Is inositol good for ovulation or PCOD?
Sure. So polycystic ovaries, we have a couple of adjuvants, we call it, which kind of help in improving the insulin resistance and, the hormonal imbalance that you usually experience during PCOS. Inositol and metformin are the two best available options that we have.
Okay.
A lot of young girls prefer inositol because it has lesser side effects as compared to metformin. And you don't experiencing too much of nausea or vomiting per se, so you're more comfortable taking it.
Okay. With regards to PCOD, I personally, as a nutritionist, I get a lot of clients suffering from PCOS and PCOD. How would you differentiate both of them, PCOD and OS?
So it's just the difference between Bombay and Mumbai.
Okay.
A Bangalore and Bengaluru. That's
Bengaluru.
it. That's it. So for a very long time, we were calling it PCOD, which is polycystic ovarian disease. And with time, we have realized that it's not actually a disease. When we say diabetes or when we say hypertension, you don't have a disease mentioned in the entire, terminology of it, which is why we change it to PCOS, which is polycystic ovarian syndrome. It's actually a group of symptoms that are present together. And it's not necessary that all symptoms should be present for everyone.
Okay.
So that's the reason why they said that they've given a cluster of symptoms and said that, okay, if 2 out of these symptoms are present, then you call them as a PCOS.
All right. And does it have to be over a certain duration? Like those two symptoms, how long do they have to be present for someone?
So we would say at least for about 3 months or 3 cycles in a year. We say it can be irregular periods, having a PCOS kind of picture on the ultrasound, having features like, unwanted hair, acne, hair loss, or, hirsutism kind of picture, or even a blood parameter elevation of testosterone levels. These are the parameters that we kind of look into.
Okay. I have so many questions around PCOS, but let's see if we have time at the end. I'll let these questions go.
Okay, can I ask the question?
Yes, Bhavna, go for it.
Yeah, ma'am, actually, I want to ask, जो V-wash and all that vaginal wash, जो आजकल दिखाते, are they safe to use?
There is more than safe. The point is, is it necessary for us to use them? That's the important question. You don't really need to use any sort of vaginal wash, or you don't need to use any sort of agent to kind of wash your vaginal space. Simple plain water is good enough. In fact, on the contrary, you should never be using your regular body soap, or you should never be using things like Dettol or anything which is more toxic in nature or harsh in nature. You should never be using it. With respect to a vaginal wash, you can use it on certain occasions, like during your periods, or you feel that there is excessive vaginal discharge that is happening. During these times, you could probably use it, but it's not required for you to use it on a regular basis, because your vagina already has certain amount of good bacteria which are naturally protecting it. So it's really not required for you to use it on a regular basis.
Thank you.
Okay. Prakshi is saying, for menstrual pains, can we take tablet meftal-spas?
Yeah, I think that's the most common antispasmodic or painkiller women use. And in case if you're comfortable with it, then yes, if you have good pain relief with it, then meftal-spas is probably the perfect.
Okay. How much blood clots are normal during periods?
Technically, too much of clotting is not normal. Your blood should, be in a flowy pattern. It should be like proper blood. Having too much of clotty blood means that you are actually bleeding a lot, and that is getting clotted and coming in the form of clots. So excessive clotting, in fact, is not normal. It definitely reflects more blood loss as compared to what you actually anticipate. We would say about 3 pads or of regular flowy blood is equal to 1 big clot of that kind of comes out.
Wow.
So yeah.
Okay. Now next question is, I'm not sure if it is for you or me. Does ginger have any bad effects on menstruation?
I'll let you take that.
No, I don't think it has like any specific.
Yeah.
No.
So I think
Can I ask a question?
Just a second. Yeah.
So
Hello.
Just a second. Aap kaun?
Zeba sir.
Sorry.
Zeba.
Zeba.
Hi Zeba. Zeba, just a second. Can we just finish with the ginger wala question? And yeah.
Okay.
So as I was saying that with respect to food that way, unless you're taking it in like huge proportions or huge quantities that way, it is very unlikely that any sort of diet element that you're taking has any major side effect or major impact over your regular health that way. So it's not that if you take 1 piece of ginger or 2 pieces of ginger, it's going to alter your menstrual cycle altogether, or if you take about 1 or 2 pieces of papaya, you're going to miscarry or have an abortion, kind of thing. So it's only in huge proportions that you kind of do it, wherein you're talking about an extract, as a ginger extract that they kind of take, where they are intensifying the concentration of the product per se. They probably might have some amount of temperature changes with respect to your body, and as I said, they might impact the ability of your body to either clot or declot the blood, and it can affect. But just having 1 or 2 broken roots of ginger is not going to really change your menstrual cycle in a dramatic manner.
Plus one. I would agree. Okay, yes, Zeba, go for it. Hello. Zeba, we can't hear you if you are saying something.
Hello.
Yes.
Yes,
Go for it.
Zeba.
Hello.
Yes.
Yes, sir. Yes, sir. Good evening, ma'am. Ma'am, just a question है कि if my period flow is not good, then what the negative impact on my body?
So if you don't get your periods for more than 45 days, you have a risk of all this menstrual blood being accumulated in your body. You have higher chances of feeling bloated, and you have higher probability of having mood swings, and these sort of changes can happen. And eventually, when you bleed, it's going to be really heavy, and you will have higher chances of actually requiring medications to control the bleeding per se. So, so that definitely is going to be an impact. No matter how comfortable you are not having your periods, you are expected to have your periods at least once in 2 months for the safety and well-being of your overall health.
मैम जनरली ऐसा कहा था कि अगर पीरियड में ब्लड कम आए, फ्लो कम आए, वेट गेन हो सकता है, तो इज इट ट्रू?
सॉरी, पीरियड्स में ब्लीडिंग अगर कम आए तो क्या होगा?
वेट गेन होगा।
वेट गेन हो सकता है क्या?
तो it's
बॉडी में स्वेलिंग भी आ सकती है?
That's exactly what I'm saying. अब bloating और ये सब जो होगा, अगर आपका periods ठीक से नहीं आ रहे हैं, 40 में अगर आपका period नहीं होगा, that is when you do experience these sort of bloating sensation per se. But most of the times, अगर आपका PCOS है या कोई hormonal imbalance है, जिसकी वजह से आपका bleeding कम हो रहा है, that in itself can cause weight gain for you. So everything is interrelated. We can't say that if the egg has come first, or the chicken has come first. So it's like that.
Yes. Somehow, like that I connected with that so much in my nutrition sessions. I always try to say that nothing, the ginger wala question, I get that question a lot, like, sir, lemon and honey water, warm water, can I drink that to lose weight? And I was like, no, only one thing can never help you or harm you. It is the combination of so many things. So if your diet is otherwise messed up, then nothing is going to help you. If your diet is otherwise good, then honey or lemon water can escalate or can help you as an antioxidant, But yeah, awesome. All right, I think all the questions are being covered. There's one question, but the lady is not here. She just left with a fact or a comment saying, I have heavy bleeding during my period time, and then she left. So I don't think she had a question there. Guys, do we have any other question? I think we are almost towards the end of our session, and you know what time it is now, right?
I actually barely realized that our time is already almost up.
Yes, 47 minutes done, and it's a selfie time. So let's get ready for the questions and the selfie at the same time. We'll have 5 more minutes. 5 more minutes. Do we have any more questions? Yes, Anjali, go for it.
I want to ask.
Yes, P.
Yeah, Poonam. My name is Poonam.
Hi, Poonam.
Ma'am, I want to ask that polyp is a reason caused because of unbalanced period, not proper period.
Polyp is a reason for.
uterus polyp is
Mhm.
also not proper period.
Yes, so polyp can give you intermenstrual bleeding. It can give you heavier flow. It can make you have a lot of premenstrual and postmenstrual spotting. So these are a couple of symptoms that you can have because of the polyp. And sometimes a polyp can just be there and not cause any symptoms for you at all.
Hmm.
It can also result sometimes in what we call as post-coital bleeding. So after you have intercourse, because there has been some amount of exertion over the polyp, you do tend to have a little bit of bleeding in those kind of scenarios. But yeah, it is very likely that some might not have any symptoms at all despite having a huge polyp.
What is polyp, by the way?
So polyp is a fleshy mass or a swelling, what we call, that's present. It can be present anywhere. In fact, it can be present inside the nose. We call it as a nasal polyp.
Polyp, yeah.
In the throat, we call it as a oral or oropharyngeal polyps. It can be there inside the intestines. It can be there inside the uterus as well. So
Okay.
they're just fleshy portions or masses.
Okay. Interesting. I think we'll take these two quick ones. First is, why are PCOS or PCOD people overweight?
So it is because there is a hormonal variation. Our weight essentially is determined majorly by your BMR, that is your basal metabolic rate. So if I am having a great BMR, I might be eating the exact same amount of food as you're eating, and I might not gain weight because all the food that I am eating is actually getting converted into energy, and only a certain part of it is getting deposited as fat inside the body, as compared to someone who is having a poor basal metabolic rate, wherein whatever they eat might actually be getting converted into fat, and a very small quantity is getting converted into energy, and that's the reason why they have a higher tendency towards gaining weight. So likewise, PCOS also causes certain hormonal variations inside the body, which will affect your BMR ultimately and increase the possibility of you gaining weight.
Nice. Final one. Trimming or waxing or removal cream, which is better for private parts?
Removal cream, so you should never, ever, ever do it. Ever, mane, ever, neither over your breast region nor over your pubic region. It is very, very clearly mentioned on all hair removal creams that you cannot use them over private parts. So it's a definite no-no. We've had a couple of unfortunate incidences wherein young girls have had really bad rashes over the pubic region because of using it in these parts. Just because someone else is using it and they are not having any effects, please don't get into it and never use it, because it can cause long-term implications per se. Beyond that, be it either shaving, trimming, or waxing, it's some women even get laser done. It's a very individualistic choice. From a hygiene perspective, it's really not going to change anything. It's a individual perspective. Definitely no hair removal creams. Rest everything else, it's your choice.
Okay. Awesome. So someone is saying Evertine cream mentioned for private parts.
Which is exactly what I'm saying, that most of these, let's say when we talk about wheat or a couple of other most commonly used hair removal products, they have specifically asked for you not to use it in the private parts region. Even in case if there is anything that is specifically mentioned that you can use it, you have higher chances of reaction or allergies. And we've seen that more women have vaginal infections following this sort of hair removal, because there can be incidences of inward hair growth and folliculitis happening, infection happening these spaces. So definitely no hair removal creams for private parts.
Oh, more questions coming, but I think we are running out of time. I'm sorry, girls. I'm
I'll,
sorry.
I'll, I'll probably put up Ask Me Anything session sometime soon, and I will be happy to answer. I think Chaitali's question, I'll just take it. Yes, shaving is absolutely fine. Waxing is also fine.
Hmm.
And trimming is also fine.
Okay.